Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, here with another of our Facebook Live updates. I'm wearing my new balaclava. Yeah, I kind of like this one other than it shows my skin underneath. But it works pretty well. I'm going to take it down so those who can read lips can also enjoy tonight's presentation. So again, Dr. Bob Dannenhoffer, this is our Facebook Live. And this is, and this is Facebook Live, and this is your chance to go ahead and ask questions. The state did a Facebook Live last week, and theirs was pretty good. So if you want to check it out, OHA did one last week. But I don't think it's as good as ours because people in the audience didn't really get to ask as many questions as you do. So if you have questions, put them in the comment section and we'll do it. Please be kind. There's some people who like to attack each other there, and we don't need to do that. We can just talk. Anyway, so let me go through where we're going. This is still a very active pandemic in the world. I really hope to come to you one day in the near future, I would hope, and say, we're pretty much over this, but I don't see that happening for many months. 15 million cases, 620,000 deaths. So we're now starting to approach a death level that really dwarfs many of the other infectious diseases. Still very active in South Africa, US, and Brazil. We're also starting to see activity in Colombia, still lots of activity in Peru. Chile actually has one of the highest case rates in the world, so still lots of disease out there. But there are many countries in the world that have seen a very low case rate recently, and New Zealand and Australia still are battling with a few cases. South Korea occasionally has a case now and then, but for the most part, the disease is quiet there and is quieting in Europe. In the US, we're at 4 million cases, and we'll hit 145,000 deaths today. It's a lot of deaths. I mean, when you consider how many deaths we had in the wars, how many deaths we have in other things, that really is a lot of deaths, and we're not nearly through this. Still very active in the U.S. in California, Florida, Texas, Georgia, and Arizona. Interestingly, all very warm places, so any hope that warmth was going to get rid of this really never came to pass. Oregon continues to add cases, 200 to 300 a day, which is a little bit better than it was a week or two ago, but still way up from where it was. You remember in May and June, we were sometimes adding only 10 or 11 cases a day. There's lots of other new stuff here, but send in your questions. We'll do them first. So the first question that Lauren says is, what are your thoughts about kids going to school for elementary school? Well, a lot of new interesting information came out from school. Since there are other places that have started schools, we're getting to learn from other areas what happens. Turns out that kids less than 10, so kids in elementary school, do get the disease a lot less. They do seem to get less sick, and they do seem to spread it less. So for elementary schools, much safer than high schools in terms of reopening. Kids 10 and above, it seems like when you hit puberty, you begin to spread this like an adult. And again, that's not surprising. There are many things at puberty that make you more like an adult. And at least in high school, the kids don't get as sick, but spread it as efficiently as adults. So high schools, I think, are going to be a little bit riskier. Elementary schools, I think, are going to be much safer. Yeah, how long for the test to come back? Oh, way too long. Really to do a test, the ideal is if you do a test to get the test results back right away. Sometimes that can't happen, but really by the next day. I mean, these tests take anywhere from a few minutes to a few hours to do. So there are some tests that just take a long time. So there are these things called blood cultures that we do when you're in the hospital and we think you have a bacterial infection. We take your blood, we put it in a bottle of broth, and we wait for the bacteria to grow. Well, there's no way to make bacteria grow faster than that, and so it sometimes takes 1 or 2 or 3 days for it to grow. These tests are not like that. These tests never take more than 4 hours to do, and so you should be getting them back the next morning. Some are taking a week or 2 weeks. This is very problematic. Remember, the average incubation period is 5 to 6 days. The end of the incubation period is 14 days. And what we're seeing is that some of these tests are not coming back for 13 or 14 days. Well, if they're not coming back for 13 to 14 days, they are very, very, very limited usefulness. So although we had kind of gotten past the testing problem in May when the case rate was low, now that the case rate has roared back, especially in big populous states, so Florida, Texas, California, all big states with lots of people and lots of disease. And with lots of people and lots of disease, they're doing a lot of tests. as well as in our country, we're doing a lot of nonsense tests. If you're testing these NBA players every day, every baseball player every day, we're using a lot of testing capacity for those things. In addition, we're doing a lot of asymptomatic testing for really unknown reasons, and we're wasting a lot of test capacity here. This is an area where we need a little bit of leadership to say, look, let's stop doing the low likelihood tests and work on the symptomatic tests. So Desiree said, is it true that if somebody tests positive once and then again they get counted twice? Well, the positive tests get counted as many times as you're positive, but the person only gets counted once. So if I got the disease, tested positive, 3 weeks from now I got tested again, I would tested positive again, it would count as 2 positive tests, but 1 positive person. So when you look at our data there on there, it doesn't say positive PCR tests, it says persons with, or people with positive PCR tests. We do not count them more than once. So Lynn says, what are your thoughts on the Oxford vaccine, and would that be available for us in the U.S.? So the U.S. has helped to fund the Oxford vaccine, and I listened to Dr. Fauci last night, and since we funded part of the vaccine, the U.S. will get doses of this vaccine. If we have time later, we'll talk a little bit more about the vaccine, but I think it will be available. There are 4 phase 3 trial vaccines that are out there. That's a lot. And the hope is that 1 or more of these is going to be effective, and that we're going to have protection to the U.S. Although when we looked, it really doesn't look like this is going to be widely available until the early 2021, and maybe even later. So Dorothy says, do you think we will go back to phase 1? I really hope not. The data came out for places in the state. Douglas County is the 3rd lowest county rate in the state. So unless the whole state goes back to phase 1, I don't think we're going to go back to phase 1. But I do worry that there are a number of counties in the state that are really, really hurting. They're having 10 times the amount of cases we are, and really struggling, even in these tiny counties. So I got a call today from the health authority asking if we could help out other counties that are really struggling, and some counties are really struggling. So I don't think we're going to go back. So, people are worried that we've lost this fight. We really, really, really haven't. We've not lost this. I think if we go another 3 or 4 weeks and continue to have increased number of cases, we might. But right now, we have not lost this. So, I'm pleading with people to do a couple of things. The first one is to stay home when you're sick. When we look at our cases, again and again, we hear, well, I was sick and still went to work because I just thought it was allergies for a couple of days. And they exposed a bunch of other people. Don't go to work if you're sick. The second is to socially distance. So many of the cases we have are at parties, and we say, how close are your parties? Well, how close you get at parties, you just talk to people and you share food and whatever else. So parties seem to be another one. And out-of-state travel seems to be related to this. We've now had cases in the last month associated with, and let me go through the list here, I may miss a state, Alaska, Washington, Idaho, Utah, California, Texas, Florida, and Michigan. There's almost no states left here. And so people travel to those other areas, do high-risk things in the other areas and come back, or people from high-risk areas come to parties, 4th of July, whatever, visit a bunch of people and expose so many people. So we haven't lost this yet. I really, really, really don't want to go back to phase 1. So I'm pleading with people, if you have this trip planned, hold off for a while. If you're going to have a party, hold off for a while. If you're sick, don't go to work. So if we did just those 3 things, we would do it. Masks will clearly help, but masks don't help if you go to a party, because I'm not expecting anybody to wear a mask at a party, but don't have the party. Be careful about the travel. And I don't think we've lost this. I mean, we've been averaging 2, 3, 4 cases a day, but we still could get this under control. So please, please, please. So Melinda says, if you get tested at Mercy, is it a nasal swab or a mouth swab? Well, they have multiple platforms, so depending on which platform they use. So a friend of mine was at Mercy the other day and had a deep nasal swab or an anterior nasal swab, but you can, depending on the test you use different swabs. Again, the most accurate tests is the nasopharyngeal swab, like we use here, that goes deep in the back of the throat, and gets sent away to a lab. So that's the most accurate test. The problem now is that long turnaround time. So there are other tests that are a little less accurate but have faster turnaround time, and you have to balance the two. So a friend of a friend went to get tested in Corvallis but left because the wait was too long. Then 2 days later, they get a letter stating they were positive. How can this be? I don't know. That's a mystery. That's a mystery, I would call it, and find out. You know, it is one of the troubles that places have had in drive-thrus that don't do appointments. Just these drive-thrus that just come through and drive through, that there are frequently, you know, two people with the same kind of name or something else, and that's what happens. This is why we're very, very careful when we do our drive-thrus, that we do these by appointment, so we get a chance to be sure that the paperwork is correct. And we were talking today, and over 1,000 we've done, we don't think we've had a single mistake. I don't know about that. There's no way I think that could happen. All right. So how are delayed testing results affecting the ability to control spread? Well, they're affecting it a lot, right? So let's say person A has the disease, and he goes to work on Monday and Tuesday and is around person B and person C. Now, if he now gets sick on Monday, Tuesday, then he leaves work. On Wednesday, he comes to get tested, and we find he's positive. By Wednesday, if we get the results back on Thursday morning, we can call him and say, who are your contacts? And he said, B and C were my contacts. They're not yet in the contagious period because they were just exposed on Monday and Tuesday. We can put them in quarantine, and we know that that outbreak will end. However, if this guy on Monday the 1st got sick and we don't get his, and he gets tested on the 3rd, but we don't get his test results back to the 17th, those two people he infected are already in their infectious period and could well infect others. So for this to work, we need to have testing where we can get it no later, I said 72 hours in an article I wrote today, but really should be 24 to 48 hours to get the results back. So this long testing time is really hurting, and this is why we as a country need to figure this out. Now, if you want to test ball players every day or whatever, athletes before they return to college and whatever, that's okay, as long as people who really need the test, healthcare workers who are sick, people who are sick and we're trying to control an outbreak, can get a test done sooner. So we really need a little leadership on this to make priorities. So what I was talking about before is, you know, there's all kinds of nerd podcasts out there, and if you want the nerdiest of nerd podcasts, it's called This Week in Virology. So TWIV, episode 641. So Dr. Fauci was on that, and really for us nerds, this was great. I mean, this was nerd nirvana here. It was a bunch of people who really know a lot about viruses, but it was at a high level for people to do it. But I think many people who listen here appear to be on that high level. A couple of things he talked about. One was about the vaccines. He's very enthusiastic that these vaccines are going to work. They used this mRNA vaccine from Moderna, and you got a lot of antibodies. It's a little bit of local fever and soreness, but not any other side effects. And those antibodies seem to be working, so that was good. And then he talked a little bit about the Warp Speed project. And so the Warp Speed project, you know, worries some people. It's like, yeah, go Warp Speed, or are you going to like forget to do all the safety things? And he explained it well. So in the past, what you would do is you'd get a phase 1 vaccine. You get a vaccine, you do a phase 1 trial, which is just a few people. You spend a few months analyzing it. If it looked good, you then put some money into making more vaccines so you could do phase 2. And then you do that, you look at the data. If that looked good, then you move on to phase 3 and then move forth. And because of that, the reason they do that is because no sense putting all of the money into making this extra vaccine if it's not going to work. And so that then really slowed it down. So the Warp Speed project was the idea to say, okay, after you get to phase 1, let's just assume phase 2, you're going to get to phase 2, so make the vaccine. Now, if it doesn't work, what they'll do is they'll just say it didn't work and just stop right there. So you said what this does, it may waste money because you have some vaccines that may not work, and you've wasted the money making this vaccine, although it doesn't work, but it'll save lives and save time. So that's what he talked about. They also talked about this idea of a $1 saliva test. So for people who've been watching for the last 8 weeks, I said what I want for Christmas is the saliva test where you can spit, take your shower at the end, know if you're infected. And so they're calling it the $1 saliva test. I'm calling it what I want for Christmas. They did not think it was going to be available for Christmas, but if it is, that's what I want. We had 2 challenges this week. One is to come up with a report that would give better information than the report we put out daily. We've had no takers on that. So again, if you have things about how to make it better, let us know and we'll do it. The other one was letter to the governor. If I was the governor for a day, what would I do? And one of the people wrote in, they said, well, if I were governor for the day, I'd really want to know the level of mask use in different communities. And I thought that was great. I thought that was a great suggestion. Well, I can tell you this morning, the governor saw exactly that data. So if you look in the New York Times on July 17th, it has a map of the U.S. and splits the U.S. up into areas where they did questionnaires about mask wearing. And it showed that Douglas County was just about average in the country. But there were places in Oregon that were a little higher than average and places in Oregon that were a little lower than average. So it goes down by county. So July 17th. And the governor took a long time looking at this today. So you got your wish. Yeah. So Tricia says, what's causing the delays? Not enough lab people, labs out of state. So what is causing the delays are we believe, well, there's lots of reasons, but we think that the limiting factor is the machines itself. So there are these machines, and you've seen them on TV and whatever. They've got a bunch of different specimens here. You put them in, and they run through, and they take 3 or 4 hours per test, and they can typically do each machine 300 or 400 tests at a time. And the machines just are running 24/7, we're told. And the reagents and the swabs and whatever are not the limiting factor now, although the swabs may well be a limiting factor in another month or two. But it's the machines that can run human samples. And that seems to be the limiting factor. You say, well, why doesn't everybody just buy an Abbott ID and do it? Well, fortunately, the people who have Abbott IDs, each test requires a cartridge, and the cartridges are in very short supply. So it really appears to be the big machines that can run these. And these big machines run, it costs $1 million each. And they take, months and years to produce. So that seems to be the thing. The labs out of state, so the labs that many of us are using don't do just one state. So they do the whole nation. And so when there are a lot more tests requested in Arizona, Texas, and Florida, these companies kind of balance the load and they take the whole state. And they do it by priorities. So many of these cases in Florida and Texas are people who are in the hospital. Those are the highest priority. And they get done first. And our tests, which are people like we'd want to know about this guy who was sick at work, are a lower priority. And they get lost. Now, how do the baseball players and the basketball players get checked every day? They have a lot of money and they bought their own machines. And because they have a lot of money and bought their own machines, they did it. They should be helping us out. So would I send my child to school this fall? Well, my kids are all past school age, but I do have grandchildren. And it's interesting, their parents have chosen not to and to do homeschooling. I think if we got the conditions correct, I would. And the correct conditions are very complicated. Actually, I spent my whole day today doing that. And there's going to be a letter coming out soon that talks about the conditions. There are 3 conditions that you need. One is that an area can't have a lot of cases. Because if there are a lot of cases in the area, schools are always going to have cases. They're always going to be shutting down schools. This on again, off again in schools is just going to be absolutely difficult. And parents are going to be absolutely frightened if they go to school, there's another case, go home, another case, go home. We can't do that. So you have to have a low level of cases. And what's that low level of cases? I don't know what it is. In the rest of the world, the level of cases was quite low. It was about where we were in May, a case or 2 a week. We're now having a case or 2 a day. You can't open schools at that rate because so many schools will have cases. If we got down to that level, So I set a few criteria. One is you'd have to have a low level. The second is public health to be ready to handle it, and we are. And the third is you'd have to have the testing available. Right? Imagine sending your kid to school and finding out that there was a case in the school, and then the recommendation is your kid gets tested, and they say, well, when I get the test back, and you say 2 weeks, that ain't going to work. Right? You have to be able to get the test back more quickly. But yeah, if we did all those things, perfectly good with sending my kids to school. So what's the recommendation for a person traveling to Texas for a funeral? Well, I'm sorry that you have to go to a funeral. Texas is a very, very, very high-risk area, and Texas is a big state if you've ever been there. And it's a big state that's very variable. So, for example, Corpus Christi and Hidalgo County are just reeling these days. So if it's an area where there's a high level of background disease, and you can find that, you should be cautious about going. If you are going to go, then what I would have you do is quarantine before you come back to Oregon. Because, for example, in one case to a different state, not to Texas, person got there, came back, went back to work, got sick, infected others, or exposed others. So, yeah, I would have you quarantine somewhere along the way about that. The problem, unfortunately, with Texas is most people will be flying, and you're going to have additional exposures in the airport coming and going. So Wendy says, is it true that an mRNA has never been adopted and used on humans before? And so will this RNA vaccine actually genetically modify us with DNA changes? So of all the vaccines we use, none are mRNA vaccines. So there's not been one used in humans before, and that is a concern, right? So anytime you're trying something new, there are maybe unknown consequences of what's going to go on. The question is, will this RNA vaccine actually genetically modify us? No. So this is messenger RNA would not genetically modify us. So remember, messenger RNA is just sort of the big picture way I look at it is like each chromosome is one book in the encyclopedia. For those of you who can remember encyclopedias before Wikipedia, that each chromosome is like that. Each gene is like a page, and those are all made of DNA. The mRNA is the scratch pad, so that you take notes and you say, this is when the Civil War started and whatever else, and the mRNA then tells the cells to make proteins. So it's really just the scratch paper. We do not think the mRNA vaccines will genetically change us. But my concern is that since we've never used one, people who are already skeptical of vaccines will be even more skeptical of this vaccine. And vaccine skepticism, I think, is going to be a big issue. So someone says, if someone has symptoms and gets tested, why are they not isolated and contacting tracing started right away? They are isolated. So when somebody does have a test and has symptoms, we strongly recommend that they are isolated until all of their symptoms are resolved plus 3 more days, or that they wait for the result of the test and wait until all the symptoms get done. So they are isolated right away. There are about 50 times as many people who have symptoms who have the disease. So doing contact tracing on everybody who just has symptoms is hard to do. But as soon as we know the results, and again, you get the results back in 2 or 3 days, you'd have plenty of time to isolate them. And this is another reason we really worry about the long turnaround time. Okay, a couple of things that came out. Big long thing about this infection fatality rate. I probably read more about the infection fatality rate all along. The infection fatality rate was if you knew everybody who had the disease, what would be the infection fatality rate? And I think we're sort of crystallizing on a number about 1. Now, some people would say it's a quarter. Some people would say it would be 0.25%, 0.5%, or 1%. Still high. I mean, that's, flu, if you look at the same kind of things, is going to be 1 in 1,000 at the highest and 1 in 10,000 typically. So, this is a high frequency and a high death rate disease. The other thing about this disease is that leaves a lot of people very badly injured. And so there are some diseases that kill you or don't kill you, like SARS killed you or didn't kill you. The survivors of SARS didn't seem to have much long-term sequelae, not with this disease. In survivors of this disease in the ICU, many of them wind up on dialysis forever. Kidneys have stopped working. They wind up with dialysis. There are a lot of people who have brain injuries and stroke and have to recover from the stroke. And there are a lot of people who have clots. So Nick Cordero, who is this singer and dancer, he had a lot of the bad side effects, including loss of a leg, kidney disease, or whatever. So there are a lot of people, even people who survive, who will have long-term troubles. Still do not know about the lung stuff, but some of these lung changes have been persistent on CT scan, and that's worrisome. And even what we found is that people who said they were totally asymptomatic never had symptoms. When you look at their lungs, their CT scans are abnormal. So the worry is, although they may not have had symptoms, they may have had damage. Other thing is about the herd immunity, again, on the Dr. Fauci thing. He thinks a nationwide level of immunity is 3 or 4%. In New York, 22%. That's basically what we thought. So at this level, we don't think we're at herd immunity. The other one that came out is about budesonide. I think we've talked about this 3 or 4 times before. So budesonide is a steroid, and it's been used for a very, very long time. It comes in both an inhaled form called Pulmicort, and it also comes in nebulizer form, also called Pulmicort. And it's very safe, very effective for asthma. It's a drug that we've even used in preemies who have lung disease after coming off the ventilator. And so we think it's a very safe and very effective drug for people with asthma. The question is, does it work for people with COVID? And there's this one guy from Plano, Texas, who says, yeah, it's the greatest thing. People coming sick, given an updraft, they say, I've never felt so good, and I feel great, and I was really going downhill, and now I'm feeling better. So it's a very intriguing story, because we know the steroids work later on in the disease with Decadron and people who are on the vent. But, it's a very interesting thing. Unfortunately, I've not been able to find anybody who's given the similar story. Now, if it was such an easy thing to do, probably there are many ED docs said, well, it's not dangerous, let me try it. And they would report similar miraculous results. I haven't seen it, and I keep looking because, boy, wouldn't that be great? This is a drug that every pharmacy has. This is a drug that's easy to give and very safe. I only wish it works, but boy, I haven't seen it. Someone also asked about RNA and DNA. They've never found the DNA on this virus, and they never will, because there is no DNA on this virus. This is an RNA virus. They did find the RNA very early. Actually, by January the 10th, they had the full genome sequence on this. So, yeah, we'll never find the DNA because there isn't any, but we found the RNA early, and we know what it is. Interesting story came today from Switzerland. There was an outbreak in a bar in Switzerland, and they found that some of the servers used face shields. Some of the servers used face masks. Some of the servers used face masks and face shields. Anybody who was wearing a mask didn't get the disease. People who were only using a face shield without a mask did get the disease. Hard to know what to make of that. They're the first people to report that. Other people think that face shields may be better than face masks. But like anything in this early developing thing, you're going to find all kinds of new stuff. Yeah, so Sandy says, well, could we repurpose other labs for COVID testing? Yeah, we could. It's going to take some federal intervention on this one because there are a lot of rules. You can't just do a test for people. You have to get CLIA certified and whatever else. So there's a lot of ability out there to do testing, but it's not in CLIA approved labs. So you may remember back early on this deal that there was a lab that was doing studies in Seattle called the Seattle Flu Study. It's not a CLIA approved lab because it wasn't expected to do any clinical specimens. And they said, well, look, we're seeing a bunch of COVID. and they got shut down because they weren't a CLIA lab. Yeah, if we really worked on this, what we could do is we could take all the labs that are doing other kinds of PCRs, and people are doing PCRs for all kinds of things, other diseases, other kinds of research and whatever. And yeah, if we had a dedicated national strategy to maximize and prioritize the use of testing, that would be great. I'm really looking forward to it. Okay, so how similar is the spread of H1N1 and COVID? So we held schools during that crisis, but not with COVID. Why? So H1N1 was less contagious than COVID. H1N1, we had a vaccine for it within a few months after it got here. And H1N1 a lot of people got it, but was not that deadly. Even with that, though, we were still worried about it. We still did a lot of work on it, but it was much less deadly, probably 100 times less deadly than COVID. So I think it is the lethality of COVID that worries us, and the fact that it's also much more contagious. So it's more contagious and more lethal, much more so than H1N1. H1N1 was an unusual one because it came in an unusual time of the year, right? Flu usually comes in January, February. This one came in the fall of the year, and a lot of people got it. And the people who got it were miserable, but not very many wound up at the hospital. So I was actually at the hospital at that time and knew how many people, and we would have like 2 or 3 in the ICU. You can handle 2 or 3. You could not handle, and if we did nothing with COVID, we would predict that we would have 100 cases a day in Douglas County. We had 100 cases a day in Douglas County. We think about 10 of those would get admitted. They have an average length of stay of about 2 weeks, which is also much longer than the flu. So they have an average stay of 2 weeks. So we'd have 100 or so patients in the hospital every day with this. We think of the people get hospitalized, about a quarter of them need ICU care. So we'd have 25 people in the ICU every day for a long time, because it takes a long time to build up herd immunity. Who knows how much you need? Do you need 50%, 60%? But 50% means 50,000 cases in Douglas County. So we're going to have even 100 cases a day. It takes a long time to get to 50,000 people. And that's why it's different, because it's not like people have just grown nervous or whatever. I was there during H1N1, and I was right in the midst of it, and I knew a lot about it. We didn't recommend shutdown because it was, we weren't going to have refrigerator trucks in the hallway, in the roads, to pick up the dead bodies. But that's what they're doing in Texas. There's a convoy of refrigerator trucks going down to pick up the dead bodies. There were refrigerator trucks in the hospitals in New York. We didn't see that with H1N1. Yeah, this is great. Any update on Pepsi? I still can't get my prescription because of the shortage. Doesn't have COVID-19. So once or twice a week, I attend a seminar on the latest and greatest is this, or the latest and greatest is this. About 6 weeks ago, it was Pepsi. And actually, the original data looked pretty good. It came from an observation in China that poor people did better than rich people. The thought being that poor people took more Pepsi and rich people took more omeprazole, because omeprazole costs about 100 times what Pepsi did. So the poor people took the cheap man's antacid, and the rich people took the rich person's antacid, actually. They both work about the same. And then, so somebody noted this in China, and then in New York, they looked and they said, hey, yeah, it really does seem to be the case. I have not seen a single more thing about it, that it works. But I'll look again. Actually, I haven't looked in about a week, so I'm going to look again. Yeah, so what % of people have mild symptoms or asymptomatic? I think the best data suggests that 40% of the people are asymptomatic, about 40% of the people are mildly symptomatic, and 20% of the people pretty darn sick. About 10% of the people get hospitalized, and 2 to 5% of the people go to the ICU, and 1% die. Now, those numbers are certainly very different given the age group, right? If you have old people, more likely to be hospitalized and die. If you have young people, less likely. But if and this is, it's going to vary, but 40% asymptomatic, 40% mildly symptomatic, 20% pretty sick, 10% go to the hospital, 2 to 5% in the ICU, 1 or 2% die. Yeah, do we know the cause of the recent high level of spread in some rural communities? I do. So some of the counties have had high spread because they've had workplace outbreaks. So workplace outbreaks in food processing plants. Union County had an outbreak in a church. Some counties have had an outbreak in the prison. And so those are big outbreaks in one place, and then they spread to other areas. There's other problems in those areas too. They don't have a lot of people in public health. So if you look at like the public health department in some of these counties, it's like 3 people. And so it doesn't take much to overwhelm them in these little counties. In fact, we got a call today to see if we can help out another county. I haven't told the team yet, but I'll tell them tomorrow that we got a request to help out another county because, again, we're not overwhelmed. But this is how it spreads. And then what happens is it gets into the community. So there's a workplace outbreak, but then there's somebody who's got another job and works at a different job. Or there's somebody who lives with somebody who works in the nursing home. And this is how it spreads around. And once it gets to a certain level of disease in the community, it's really, 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 really hard to get rid of without just sort of locking everything down. And that's why we don't want to go there. So again, I know I pleaded with this before, but if you're sick, please stay home. There's not a lot of allergies in July and August. So if you think you've got allergies, please stay home, at least until you're well, or get a test. Think really, really hard about travel or inviting people from other states to your home. Very much the safest thing to do would be to quarantine for 2 weeks. If they're going to do that, I had 3 questions from people today about what they should do with somebody. For example, somebody said, oh, their kid is coming, spent the summer in Arizona, is coming back. What should they do? You know, the best recommendation is for them to go to their room, stay in their room for 2 weeks in quarantine. Oh, goodness gracious. So my sister-in-law from Portland wants to come visit. We are in both high-risk categories. Is that safe? So again, there's a range of safeness, right? So one person coming from another area is not as high risk as you going to a party with 10 people or a party with 100 people. So one-on-one is always safer than 1-on-3 or 1-on-6 or 1-on-10. So that's it. But, you know, it's some risk. And so, you know, geez, if you can do it some other way, do it some other way. If you are going to come, do it outdoors. Again, outdoors is many times safer than indoors. And if your sister-in-law wants to come, say, hey, we'll meet you at the park. And we'll do this. So I had somebody from out of town who wanted to come visit, but I really wanted to see them. So we arranged to meet outdoors. We ate outdoors. We did all those things outdoors as best we could to decrease the risk. Yeah, so Allison said, if testing is taking a long time, is there a way to modify what we're doing locally to get ahead of the spread? Yes. Careful about travel. Stay home if you're sick. Socially distance. Avoid parties. You know, those are the kinds of things we want to do. So what percent of asymptomatic people who have tested positive here? Actually, I don't know we've looked at that. The best estimates for the rate of asymptomatic people is when you have a closed population, like a prison, or a cruise ship, or a warship like the Teddy Roosevelt, because then you can really test everybody and get sort of a view of people who are positive and asymptomatic. We have tested a number of people who've been part of an outbreak and who've been asymptomatic, remained asymptomatic the whole time, but ours would be a skewed sample. Now, we do know, for example, that the hospital tests people before surgery, and out of the last 1,000 cases, all have been negative. So doesn't seem to be a lot of positivity in the background here. So explain what an outbreak is. Well, an outbreak is a time where we see a group of cases. Now, in a nursing home, even one case is a worry. But in other places, when you have one or more cases, you worry about it. Outbreaks become reportable when you have 5 or more cases in a workplace that has at least 30 people in the workplace. So we had a report last week, and I think we're going to have a report this week of another outbreak. But Douglas County has had remarkably few big workplace outbreaks, and that's because we have really worked with these companies. So with RomTech, I looked before, I think it has 80 emails about the RomTech outbreak from the people of the company, from the boss of the company, from people in public health, all of these people working together to go ahead and reduce this spread, and I think we've done it. Yeah, so Amy says, why'd you pick 5? Well, we didn't pick 5, the state picked 5. Got to pick some number, right? Because if you pick 2 at a place, it may not really be an outbreak, it just may be bad luck. Once you get to 5 in a place, it's clearly an outbreak. And whether you pick 3 or 5 or whatever, you had to pick some number. So when I was in the Navy, I was really I must have been really a problem, because I would ask all these questions. Like, your hair had to be certain long. I said, where'd you get 3/16 of an inch? I mean, could you even really measure the difference between 1/4 and 3/16? And finally, after a while, they said, Bob, please, we had to pick something. And so you just have to pick something. And so what I've learned from that is you sometimes just got to pick something. And it's probably not going to be perfect. It probably won't satisfy everyone. But you have to pick a number which is big enough so that the random cases don't trigger an outbreak, but not so big that you could have spread without you knowing. So Shirley says, can I wear a face shield with COPD instead of a mask? Yes. We think face shields are pretty darn effective. Now, again, that Swiss report today suggested it wasn't effective in preventing you from getting the disease. But we think mostly it's pretty effective in preventing others from getting the disease. Again, and people have COPD, other breathing problems, or people just have a mask phobia. I mean, this story that I heard about this person who was sexually abused by somebody covering their face, I can imagine I would never want to wear a mask again. So please, if you can wear a face shield, that would be great. I'm thinking many more face shields out there. And I ordered one from Milo's, and it's one of these industrial ones. It's great. I look like Bob the Builder, somebody said, so that works out great. I can also use it in the shop. I've seen more people with lower tech ones. I think that works okay. And then I saw one this weekend of somebody, it looked like it sort of came up this way. So you had sort of a necklace thing and it came up. My wife said it looked like one of those doggy collars that you can't lick yourself, but it worked, and the person said it was really quite comfortable, and it really wasn't the least bit thing. So if you want to wear a face shield, please do that. Okay, a couple more things. Again, the school thing is going to be a big deal over the next few weeks, and we'll look at that. Schools have the option to do in-person, hybrid, or distance learning. We worry about doing everything distance, right? Doing everything distance is the lowest risk for COVID, but schools are in many places a big resource for kids. They can socialize, they can get a good decent meal at school, they sometimes get health care at school, they sometimes at school have somebody who really cares about them and can help them in their studies. So we would really like kids to go to school, but recognize there's a risk. So I think we're going to try and be much more clear about that over the next bit. So again, on the face mask wearing, New York Times, July 17th, and there's a very nice map that you can search and find the numbers. And again, Douglas County is between 50 and 60% mask wearing area, and that's a very good thing. Okay, that's all I had. So again, remember we have 2 challenges. One is if you have a better way to display the data or things in the data that we're not including that you'd like to know, let us know. And please put it in sort of, you can simple format and send it to us at mail@douglaspublichealthnetwork.org. The other thing is if you'd like to be governor for a day, and if you were governor, this is what you would do. So again, we have the one, and I'd like to know what the rate of mask usage is in the different areas in the state, and we already know that. But if there's something else, if you were the governor, what you would do, let us know. I saw in the newspaper that there was a recommendation, a letter to the governor from Dr. Powell. Dr. Powell and I have had a lot of discussion over the last couple of weeks, including a bunch of discussion today. And I think we just see it differently. So I think his view is that this disease is not very lethal in young people, and it's not. And the lethality doesn't, the high levels of lethality don't really start until you're 60 and above. And that you could let this disease move through the community, and very few young people would get seriously sick or die. And that if old people kind of stayed in and didn't get exposed very much, that the number of adults who got sick would be low, and you could kind of let this run through, and then young people would develop immunity, and that would stop this from continuing to spread. There are a couple of people who believe that, but I think it's kind of the minority opinion. But the minority opinion is not always the wrong opinion. A couple of concerns with that. One is it will mean a lot of hospitalizations and a lot of deaths, right? If you just let this blow through, you could have as many as 100 people a day in the hospital. That would really stress out the hospital, because then it would kind of make it that they couldn't do anything else. And a lot of people would get sick. And the problem, unfortunately, with this disease is for everybody who dies, there are a number of others who are left with long-term sequelae, and I'm not sure we would do that. The other problem is that back in the old days when you just let diseases go through, it was because you had no hope of having a cure. So for measles in the 50s, there was really no hope for an antiviral drug. There was really very little hope for a vaccine, because we'd never made an attenuated virus vaccine. And there was no hope for an antiviral because we'd never made an antiviral. But now, I think there's reasonable hope that within the next 6 or 12 months, we'll come up with an antiviral, we'll come up with a vaccine, we'll come up with some kind of biologic that will help. And if we can just delay these diseases from coming, we'll save lives and save disability. I will tell you, it's a very different view, and I never say to anybody that they're wrong. I just don't believe it would be the right way to go. Okay, any more questions? All right, if there are no more questions, this is Dr. Bob Dannenhoffer, Public Health Officer from Douglas County. We'll do this again on Friday. Thanks.